Okay.
Okay.
Alright. Hello guys. Thank you for coming and taking the time out of your day to join me in this information session. As you guys know, the subject we are going to be talking about is STIs, or sexually transmitted infections. These are diseases that are transmitted through sexual contact. I invited you guys because I want you to know the signs and symptoms of these infections, along with the ways that you can prevent them from happening to you. First off, how many of you here today are sexually active? Okay, of you guys that are sexually active, how many of you use protection like condoms? That is why I am here today. To help educate you on the dangers of having unprotected sex with a stranger or new acquaintance that you may not know that well. Depending on what infection you contract, you may not even show signs or symptoms, or know that you are even spreading the disease. There are many consequences of acquiring one of these infections, including pain, infertility, and sometimes, in the worst case, death. There are many other factors that contribute to the spread of STIs in the United States, including engaging in risky behavior, having multiple sexual partners, and not using proper protection during sex. STIs are an increasing problem for young adults across the United States. For instance, here's a picture of oral herpes.
Oh, gross.
Estimates include that 145 million Americans have genital or oral herpes in the United States. But it is more common in men than in women, which indicate a male to female transmission is more likely than a female to male. The first outbreak usually occurs within 2 weeks after the virus is transmitted, and the sores typically heal within 2 to 4 weeks. Other signs include flu-like symptoms, including fever, muscle ache, and swollen glands. After initial diagnosis, the patient can expect to have 4 or 5 outbreaks within a year. However, over time, the frequency of these outbreaks decreases. Long-term effects include painful genital sores and psychological distress in people that know they are positive for herpes. Herpes is often diagnosed with a visual inspection from a doctor or by blood tests. There is no treatment for herpes, but medication can be used to cut down on the number of outbreaks. Here is a picture of a penis infected with gonorrhea. There are 355,000 new cases of gonorrhea reported in 2007. The CDC estimates annually that there are closer to 700,000 new cases, but less than half of these infections are reported to the CDC. Gonorrhea is caused by a bacterium that easily grows in warm, moist areas of the reproductive tract, but can also grow in the mouth, throat, eyes, and anus. The disease, of course, is spread through sexual contact with someone that has gonorrhea. The highest rates of gonorrhea reported are from young adults and African Americans, particularly. Common symptoms in men include a burning sensation when urinating, as well as a white, yellow, or green discharge from the penis that appears 1 to 14 days after the initial infection. Swollen or painful testicles may also result. Most women don't show any symptoms or simply mistake them for a bladder or vaginal infection. If women do show symptoms of vaginal discharge, a burning sensation during urination, or bleeding between periods may persist. Long-term consequences of gonorrhea can happen if left untreated. This includes not being able to father children, or women may not be able to have children at all. Gonorrhea can also spread to the blood or joints, which can be life-threatening. Gonorrhea is curable with medication from your local doctor, but cannot repair any permanent damage done by the disease. Okay, and here is this is an image of a penis infected with syphilis. The number of reported syphilis infections grew by 15% in 2007, which continues a 7-year growth of reported syphilis infections. Most of these cases of syphilis were reported by gay men, but rates among infants and children also have grown. The demographic where syphilis has at least more prevalent is from age 20 to 39. But gay men still hold the highest percentage at 64% reported. Syphilis is also known as the great imitator because so many signs and symptoms are indistinguishable from other diseases. Syphilis is spread through direct contact with a syphilis sore. These sores are usually located on the genitals, anus, rectum, lips, or even on the mouth of an infected person. Transmission occurs during vaginal, anal, or oral sex, but this disease cannot spread through contact with a toilet seat, shared clothing, or eating utensils. Syphilis has 3 stages. The primary stage is usually marked by a single sore called a canker, which appears at the spot where syphilis enters the body. This canker is firm, small, and painless. The sore lasts from 3 to 6 weeks and heals without treatment. This usually causes the individual not to even get checked by a doctor because the sore disappears after a short amount of time. If untreated, the disease progresses to the secondary stage, which is characterized by a rash on one or more areas of the body that is either rough or colored red or brown. It could even be found on the hands or bottom of your feet. The secondary stage includes symptoms like fever, swollen lymph glands, muscle aches, and fatigue. If still left untreated by your doctor, the disease progresses to the tertiary stage, which occurs when the signs of the second stage disappear. The person will continue to be infected with syphilis. Symptoms can appear 10 to 20 years after the infection was first acquired. This eventually causes damage to the internal organs, including the brain, heart, eyes, nerves, liver, bones, which leads to paralysis, numbness, and gradual blindness, and even dementia. These symptoms may get so serious death can occur. Syphilis, when caught early, is curable with penicillin. Additional doses are needed for people with syphilis longer than a year, but reinfection may occur in anyone who has had syphilis before. Syphilis is also a main cause in being infected with the HIV virus, because the cankers caused by syphilis make it easier to transmit and acquire HIV. So, there are many types of sexually transmitted infections, but I hit on a few of the main ones. At the end of the brochure that I gave you guys, you will find a questionnaire about your experiences. I would appreciate it if you filled it out and return it to me to compile some information about STIs in our area. Before we leave, does anyone have any questions that they would like to ask? Yes.
Before the session started, I was looking through my brochure and I saw some information on HPV, and I was just curious, can you contract that through a toilet seat?
No, Jenna, you cannot. But that is a very common myth. You can't get an STD, especially HPV, from sitting on a toilet seat. A virus can't live outside the human body.
Okay, and is there any protection against HPV that you can get? Is there a shot or anything?
I believe there's something new out called what is it?
Gardasil?
Gardasil. And I guess that's a shot that your doctor can give you to guard against the infection.
It's a vaccine, yeah.
Yeah, vaccine. Yeah. Anybody else?
So
Yes.
I take a birth control pill. Is that good enough?
No, it is not. You can still acquire an STD from, you can still acquire it. Even if you are taking birth control, it doesn't protect against STDs. You will need to use a secondary barrier protection like a condom or somewhere along that lines. Yes.
Does it hurt to go get tested for STI?
No. It's quick, painless. No, it will not hurt. If there are no other questions or would like to see me afterwards, just please come up and ask me anything. Thank you very much, and I hope I have helped at least one of you out today by having this informational session. Thank you.